All month long, we have been teaming up with our ABC 15 Health Insider to focus on your heart health. And so today, the most critical piece, how to prevent, treat, and even reverse your risk factors. Dr. Shad Marvasti is joining us once again. Good morning, Dr. Shad.
Good morning, Noelani.
So how do we actually change our lifestyle? Can we make changes and prevent heart disease?
Absolutely. Heart disease is actually not something that's genetically predetermined, although having a family risk factor can increase your risk if you have a family member with it. There's many modifiable risk factors actually that are key. The most of the risk factors for heart disease is actually are modifiable. So your smoking status, your blood pressure, your cholesterol level, your weight, your blood sugar level, whether you have diabetes or not, whether you're physically active or not. And all of these are impacted by our lifestyle, actually. And so we can make them worse or we can make them better.
Medications, of course, go a long way, but it doesn't have to all be pharmaceuticals. Food is medicine, and that's a huge one in fighting heart disease and your risk.
So specifically speaking to blood pressure, the DASH diet is one that you can look up and many resources about it. So DASH stands for Dietary Approaches to Stop Hypertension or High Blood Pressure. And it's high in fruits and vegetables and high in fiber and low in sodium and low in processed foods. And this is actually shown to have the same as a medication effect in terms of lowering your blood pressure. So it really is an example of food as medicine. When we talk about heart disease in general, the best thing to prevent heart disease or prevent recurrence of a heart attack or stroke is really the Mediterranean diet. And although you may need a medication to lower your cholesterol, especially if you have heart disease, the Mediterranean diet impact has actually been shown to be even greater than the medication diet. Mediterranean diet is basically high in vegetables and fruits, small amount of lean meats, and many healthy fats. We need healthy fats for healthy heart. And the best Mediterranean diet studies have shown that the groups that ate the most extra virgin olive oil had the best predictors of heart health and longevity.
That's an important misnomer because a lot of people think that if we're talking about cholesterol and hypertension, you've got to cut out all fats. So that's really important to know about healthy fats. The other thing is exercising, moving. So what are some of our best practices? How often do we have to do it? What types of movement?
So first of all, any movement is better than no movement. So if you are totally inactive, even if you just start by walking 15 minutes a day, you can cut your risk of a heart attack or stroke by 25% just by walking for 15 minutes. Beyond that, we can get into what we call high intensity interval training, which really is not that intense. It's just basically 2 minutes of basically being more intense in your activity. So if you're using a treadmill, maybe higher speed or with an elevation with an incline for about 2 minutes, and then just at a lower speed without an incline for 2 or 3 minutes. So that yo-yo up and down of getting activity and then slowing down, that actually helps the health of our heart and our blood vessels. And long-term, that leads to great outcomes. In fact, studies have shown that people with heart failure who do that just 3 times a week for 30 minutes can reverse their heart failure by 1 level. So if they're stage 4, they go to stage 3. If they're stage 3, they go to stage 2. And if they're stage 1 or 2 heart failure, some of the patients in the studies actually no longer had heart failure.
Last one is that third factor of mental health. A lot more people are realizing they have to prioritize that as part of your overall health and well-being because stress, we know, is a major risk factor.
Basically, stress is equal to the risk that you get from high blood pressure, the risk that you get from high cholesterol, the risk that you get from high blood sugar. And so if you control all of those things, but have chronic stress, you will still be at high risk. And if you are not treating that depression, you're twice as likely to have another heart attack or stroke, even if you have totally perfect cholesterol and totally perfect blood pressure.
Well, this has been one of the most important conversations that anyone can have when it comes to Heart Health Month is taking action to save your own life and tell your family members and help save theirs. So we really appreciate your time and focus on this topic, Dr. Shad. And if you have questions for our Health Insider, other health topics that you want to see us discuss, email us healthinsider@abc15.com. Dr. Shad, thanks again.
Thank you.